my name is Paisley Robinson, and I'm going to be demonstrating my intradermal injection technique. I'm going to make sure that I follow my general principles and safety practices along with my 11 rights and my 3 checks. I'm also going to make sure that I have all my equipment ready, along with I'm going to verify all orders before I give them medication. So then I would go ahead and knock on the patient's door and go in. Hello, my name is Paisley. I'm going to be the nurse taking care of you. Can I get your name and date of birth?
Jared Robinson, 7/31/87.
Thank you. I'm going to go ahead and verify that against your wristband, and it's correct. Do you have any allergies?
No.
Okay. And then from here, I would go ahead and perform any necessary assessment before giving any kind of medication. So next, I'm going to go ahead and demonstrate the sites that you can give an intradermal, which there is 3. Can you go ahead and stand up for me? So the first site is the inner forearm. So right through there. The second site is the upper chest. Can you turn around for me? And then the last site is the upper back, just below the scapula. And those are the 3 sites that you can give intradermal. You can go ahead and have a seat. So then next, I'm going to go ahead and demonstrate on my injection pad. So I'll go ahead and perform hand hygiene. Go ahead and put my gloves on. And then for this injection, we're going to be using a 27 by a 1/2 inch. So for intradermal, you can use a length from 3/8 to a 1/2 inch. And then you can also use a gauge anywhere from 27 gauge to 26 gauge. So I have my pre-filled syringe. I'm going to go ahead and use an alcohol swipe to firmly, in a circular motion, cleanse the area. And I'm going to allow that to air dry. So with my dominant hand, I'm going to hold my syringe and remove the cap. And then we want to make sure with this injection that the bevel is facing up. So what I'm going to go ahead and do for intradermal, that you can go in at a 5 to 15 degree angle. So I'm going to go ahead and hold the skin taut. And then I'm also going to go in swiftly at a 5 to 15 degree angle with the bevel up. We're just going in just about 1/8, just letting the full bevel go in. And then what I'm going to do is just slowly inject that medication. And we just want to see that little bubble form. And then we're going to swiftly just remove. And then we're going to go ahead and we're going to engage the safety. Put that in the sharps container. And then with this particular injection, you just kind of want to dab if there's any kind of bleeding or oozing. You just don't want to, you definitely don't want to massage the area. So just to kind of dab there, make sure there's no bleeding. Then I'm going to remove my gloves, perform hand hygiene. And then I'm going to make sure that I immediately document everything that I've done here, the injection site. And I'm going to make sure that I come back and evaluate my patient, for any adverse effects, make sure that the patient is doing okay, make sure that there's no redness there, and just tell them to not scratch the area. It can irritate it. And that's it.